Squats are damaging your knees. And your trainer isn't going to tell you. Your physical therapist probably won't either, because everyone thinks squats are the gold standard for legs, but they're not. Not after 60. Hello, I am Dr. Akio Matsumoto. I've been treating knee and hip injuries for over 40 years, and there's something you need to understand. Squats were designed for young athletes with perfect joints, not for people over 60 with decades of wear on. Their knees. Every time you go down into a deep squat, you're putting 7 to 8 times your body weight of pressure on your knees. 7 to 8 times. If you weigh 150 pounds, your knees are supporting over 1,000 pounds of pressure at the bottom of the squat. And here's the problem. At 60, your cartilage no longer regenerates like it did at 20. The damage is cumulative. Every deep squat is wearing down a little more of that cartilage that's never growing back. Most people don't feel it immediately. They feel it years later when the damage is already done. Morning stiffness, pain climbing stairs, creaking in the knees, eventually arthritis, and everyone says, it's just age? No, it's the wrong exercise, repeated thousands of times. But there's something better. 3 specific exercises that strengthen your legs just as well or better than squats, but with zero destructive pressure on the knees. These aren't gentle exercises. They're not for beginners. They're exercises that Japanese physical therapists use with high-performance athletes after knee surgeries. Because when an athlete can't do squats temporarily, they need something that works just as well. And these 3 exercises deliver. 5 months ago, a patient came into my office, Linda Thompson, 67 years old. She'd been doing squats at the gym for 2 years following her trainer's advice. She told me, Doctor, my knees crack all the time. They hurt when I stand up from a chair. My trainer says it's because I need to do more squats to strengthen them. But the more I do, the worse I feel. I asked her to show me how she did her squats. I watched her. Her technique was perfect. Straight back, knees aligned, everything correct by the standards. But here was the problem. Her body isn't made for that movement, not at her age, not with her structure. I told her, Linda, it's not your technique. It's the exercise. You need to stop squats completely. She panicked. But doctor, if I stop squats, how will I keep my legs strong? I don't want to lose muscle. I don't want to get weak. I explained something crucial. Muscle strength and joint health are not the same thing. You can have strong muscles and destroyed joints at the same time. In fact, that's exactly what happens to many older weightlifters. Impressive muscles, but knees and hips shredded. I taught her the 3 replacement exercises. She did them with me in the office. In 2 weeks, the pain had decreased noticeably. In 1 month, the cracking had reduced by 80%. In 3 months, she could climb stairs without thinking about her knees. And her legs, we measured with a tape measure, were stronger than when she was doing squats. Today, Linda is going to explain something specific. She's going to demonstrate how to do each exercise step by step while you listen, because these exercises only work if done correctly. And after that, I'm going to explain exactly why squats are so destructive after 60 and why these 3 exercises are different. If you're over 60 and do squats, if your knees creak or hurt, if you want strong legs but don't want to damage your joints, this is for you. I have Linda on the line, and she's going to physically guide you through each movement. So get ready. You might want a chair nearby. You'll need it for one of the exercises. Let me call her.
Hello, Dr. Matsumoto. I'm ready to show everyone what saved my knees.
Perfect, Linda. I want you to guide everyone through the 3 exercises. Describe exactly what you're doing as you're doing it. Assume they're doing it with you right now.
Absolutely. Hello, everyone. Linda Thompson here, 67 years old. 5 months ago, I couldn't go upstairs without pain. Today, I hiked 5 miles last weekend. These 3 exercises changed everything, and I'm going to teach them to you right now. So if you can, stand up. Let's do this together. Okay, everyone, here we go. Exercise number 1. Wall sit. Slide for quadriceps. Find a wall. Turn around so your back is against it. Step your feet out about 2 feet from the wall. Feet shoulder width apart. Now, here's the key difference from squats. You're going to slide down the wall with your back pressed against it. The wall supports your spine completely. Slide down until your thighs are parallel to the floor like you're sitting in an invisible chair. Your knees should be directly over your ankles, not past your toes. This is crucial. If your knees go past your toes, you're doing it wrong. Step your feet out more. Hold this position for 20 seconds. Breathe normally. What you should feel, burning in your thighs. That's your quads working, but zero pressure on your knee joints. Now slide back up slowly. That's 1 rep. Rest 30 seconds. Do it again, 3 times total. When I first started, I could only hold it for 10 seconds. Now I can hold it for a full minute. Your legs will get stronger fast. Why this is better than squats? The wall takes all the pressure off your spine and distributes the weight evenly. Your knees stay at a safe angle. No compression, no grinding, just pure muscle work. Exercise number 2, controlled step U, PS4 glutes and balance, okay? Now grab a sturdy chair or a low bench, something about knee height or slightly lower. Stand facing it. Place your right foot completely on the chair. Entire foot, not just your toes. Here's the key. You're going to push through your right heel the foot that's on the chair. To lift yourself up, don't push off with your left foot. That's cheating. Step up slowly. Stand completely on the chair with both feet. Now step back down, right foot first, slowly. Controlled, that's 1 rep. Do 10 reps with your right leg. Then switch 10 reps with your left leg. What you should feel, your glutes but muscles working hard. Your standing leg getting stronger, your balance improving. Pause. When I started, I had to hold onto the wall for balance. Now I can do these with my hands behind my back. Why, this is better than squats. It's a single leg movement, so you're actually working each leg harder than in a squat. But because you're stepping up instead of down, there's no compression force on your knees. Gravity is working with you, not against you. Plus, it strengthens your balance, which is crucial for preventing falls as we age. Exercise number 3. Glute bridge for hips and posterior chain. Okay, everyone. Now lie down on your back on the floor or on a mat. Bend your knees. Place your feet flat on the ground, hip width apart. Your feet should be close enough to your butt that you can almost touch your heels with your fingertips. Arms at your sides, palms down. Instructive tone now. Press through your heels, not your toes, and lift your hips up toward the ceiling. Lift until your body forms a straight line from your knees to your shoulders. Your shins should be vertical. This is important. Squeeze your glutes hard at the top. Really contract them. Hold for 3 seconds. Then lower down slowly. That's 1 rep. Do 15 reps. Rest. Do another set of 15. What you should feel. Intense. Activation in your glutes and hamstrings. Maybe a little in your lower back. That's okay. It means you're stabilizing properly. Pause. The first time I did these, I was shocked at how weak my glutes actually were. I thought squats were working them, but they weren't. Not like this. Why this is better than squats? This isolates your glutes and hamstrings without any knee compression. In fact, your knees are in a completely safe bent position the entire time. And strong glutes are the secret to healthy knees. When your glutes are weak, your knees have to compensate. That's when injuries happen. So those are the 3 exercises. 1. Wall sit slides for your quads. 2. Controlled step-ups for glutes and balance. 3. Glute bridges for hips and posterior chain. 3 exercises. Done correctly, they'll make your legs stronger than squats ever did, without destroying your joints. I know it sounds too simple. I was skeptical too. But after 5 months, my legs are the strongest they've been in a decade. I can hike. I can play with my grandkids. I can go upstairs without thinking about it. And my knees, the cracking is 90% gone. The pain is gone. Do these 3 exercises 3 times a week? That's all you need. Listen to Dr. Matsumoto explain the science. You'll understand why this works.
Perfect demonstration, Linda. That's exactly what people needed to see.
Thank you, doctor. You saved my knees, literally.
What Linda just demonstrated aren't just alternative exercises. They're biomechanically superior for people over 60. Let me explain the science of why squats are destructive and these exercises aren't. When you do a deep squat, your knees experience what's called angular compressive loading. This means you're not just supporting weight, you're supporting weight while your knees are bent at an extreme angle. At the bottom of a squat, when your thighs are parallel to the floor or lower, the force on your patellofemoral joint, where your kneecap meets your femur, is 7 to 8 times your body weight. That force is literally grinding the cartilage between your bones. At 20, Your cartilage has stem cells that can regenerate. At 60, those cells are almost depleted. The damage is permanent. That's why many older people who do squats religiously end up needing knee replacements at 70. Now, why are these three exercises different? Why the wall sit slide is superior. Force distribution. The wall sit distributes the load across your entire back against the wall. Your spine isn't supporting compressed weight. Controlled knee angle. You keep your knees at a 90-degree angle, the safest angle for the joint. No extreme flexion. Isometric loading. You're holding a position, not moving through a dangerous range. This strengthens muscles without stressing joints. Quadriceps activation. Studies show wall sits activate the quadriceps 15 to 20% more than traditional squats because they eliminate the help from other compensatory muscles. Why? Step ups are superior. Ascending movement. When you step up, you're working with gravity in the concentric power phase. When you squat down, you're fighting against gravity, which is when damage occurs. Unilateral training. Each leg works independently. This corrects muscle imbalances that squats hide. Most people favor one leg in squats. That causes injuries. Functional balance. Step-ups train the balance and stability you need in real life, like climbing stairs or preventing falls. Lower impact load. Maximum force on the knee during a step-up is only 2 to 3 times your body weight, less than half of a deep squat. Why? Glute bridges are superior. Glute isolation. Squats primarily use quads. Glute bridges target the glutes directly, the muscles that actually stabilize the knee. Knees in safe position. Your knees never go past 90 degrees of flexion. They're in the safest possible position throughout the entire movement. Posterior chain strengthening. Strong glutes and hamstrings are the key to healthy knees. When these muscles are weak, knees have to compensate. That's when they get injured. No axial loading. There's no weight compressing your spine. Zero risk for the lower back. Now, I know some of you are thinking, but my trainer says squats are essential, that they're the best leg exercise. And they're right for young athletes with perfect joints. But you're not 25-year-old athletes. You're intelligent adults who want to be strong and healthy at 70, 80, 90 years old. Squats are an ego exercise. They make you feel strong now, but they're stealing your future mobility. These three exercises are longevity exercises. They keep you strong without destroying what can't be repaired. Make the transition Linda made. Stop squats. Give these three exercises 4 weeks. Measure your thigh circumference before and after. You'll see they're the same or bigger, but most importantly, watch your knees. The cracking, the pain, the stiffness, it will improve, like it did for Linda, like it has for hundreds of my patients. If this video saved your knees, subscribe to this channel right now. Every week, I share information like this, smarter exercises, not just harder ones. Solutions that work for real bodies, not Instagram athletes. Hit subscribe, turn on the notification bell, and share this with someone who's still doing squats and complaining about their knees. This information can save their joints. Do it this week. 3 exercises, 3 times a week. Forget squats. Your legs don't need squats. They need smart exercises. Protect your joints because you're going to need them for another 30 years. See you in the next episode.